Aches and pains are often brushed off as a natural part of aging. You wake up with a stiff back, your knees ache after a long walk, and your joints crack when you stretch. It's just life, right? But what if that persistent pain wasn't just due to aging? What if it was a hidden sign of something far more dangerous? Bone cancer? Bone cancer is one of the most overlooked cancers because its symptoms mimic common conditions like arthritis, osteoporosis, and even simple muscle soreness. Many people ignore the early warning signs and only realize something is seriously wrong when the disease has already progressed to a dangerous stage. By then, treatment becomes far more difficult. That's why this video could save your life, or the life of someone you love. In this video, we're uncovering 8 warning signs of bone cancer that people frequently mistake for minor health issues. But ignoring these symptoms could be deadly, so pay close attention. Sign number 5 is the most misdiagnosed symptom, often confused with arthritis, leading many people to delay getting diagnosed. And by the time they do, the cancer has already spread. And stay until the end, because we'll also reveal 5 essential steps you can take today to protect your bones, reduce your risk of bone cancer, and strengthen your skeletal system for years to come. Let's get started. Number 1. Swelling and tenderness that won't go away. Swelling is something we've all dealt with, whether from a minor injury, an insect bite, or inflammation. But swelling caused by bone cancer behaves very differently from normal swelling. It's often persistent and doesn't go away. Unlike common swelling, which disappears after a few days or weeks, cancer-related swelling sticks around and can even worsen over time. It's painful to the touch. Even light pressure can make the affected area incredibly sensitive, almost like a deep bruise that won't heal. Some people report feeling heat coming from the swollen area, which is a major red flag that something is wrong. At first you might dismiss it as a minor injury or joint inflammation, but if the swelling lasts more than a few weeks, it's time to see a doctor as soon as possible. Early detection is everything when it comes to bone cancer. The sooner you act, the better your chances of successful treatment. Why does bone cancer cause swelling? Bone cancer starts deep within the bone, and as the tumor grows, it pushes against surrounding tissues and blood vessels, causing swelling, tenderness, and inflammation. Tumors disrupt normal blood flow, which can cause fluid buildup, leading to persistent swelling. Inflammation triggers pain and discomfort as the body tries to fight the tumor, leading to chronic irritation in the affected area. Pressure on nerves can worsen symptoms. In some cases, the swelling itself can compress nerves, causing numbness or tingling. If you notice swelling near a bone that doesn't go away, don't ignore it. Bone cancer is rare but aggressive. The earlier it's caught, the better your survival chances. How to check for abnormal swelling at home. If you have persistent swelling, here's what you can do right now to check if it's something to worry about. Press on the swollen area. If it's painful, even with light pressure, it's a red flag. Compare both sides of your body. If one knee, shin, or arm looks noticeably different from the other, this is a concern. Check for warmth. Place your hand over the swollen area. If it feels hot compared to surrounding skin, that's a potential warning sign. Track how long it lasts. Normal swelling from minor injuries fades within a week or 2. If it sticks around for a month or longer, it's time to get it checked out. Do not ignore these signs. Bone cancer is highly aggressive, and waiting too long can allow it to spread to other parts of your body, making treatment far more difficult. Number 2. A palpable lump or hard mass. Have you ever felt a lump or hard mass near a bone that wasn't there before? A tumor can sometimes grow large enough to be felt through the skin before it even causes major pain. It feels like a hard lump under the skin. It may start as a small, painless nodule that slowly grows over time. These masses are most common near joints. They often appear around the knees, shoulders, pelvis, or ribs. At first it may not hurt, but as it expands, it can press against nerves or blood vessels, causing discomfort. If you feel an unusual lump on a bone, don't wait for it to go away. Get it checked immediately. Number 3. Reduced mobility and stiffness. Does it feel like your joints just aren't moving like they used to? Are stairs suddenly harder to climb? Many people dismiss stiffness as normal aging, but when it's caused by bone cancer, it gradually gets worse. First, small movements feel harder. You may struggle to bend over, reach for objects, or lift things you used to carry with ease. Then, even simple tasks become a challenge. Everyday movements like walking, dressing, or getting out of bed feel exhausting. If you find yourself leaning on furniture or railings to stay balanced, it's time to pay attention. If stiffness or joint pain doesn't improve and gets worse over time, don't ignore it. Bone cancer weakens the structure of your bones, making movement harder. Fourth, sudden bone fractures without a major injury. Imagine breaking a bone after a small fall or even a simple movement like standing up. That's not normal. Bones become fragile due to cancerous tumors. As the tumor grows, it weakens the bone from the inside. Small impacts cause serious injuries. A simple twist, bump, or sudden movement can result in a painful fracture. Inflammation and discomfort follow. Even before a break occurs, you may feel like the area is unusually sensitive or inflamed. If you break a bone without a clear reason, your doctor should investigate for underlying causes, including bone cancer. Fifth, persistent bone pain that won't go away. This is the most common sign of bone cancer and also the most ignored. Many people confuse bone cancer pain with arthritis, muscle soreness, or even just getting older. But here's how it's different. It's deep, aching pain. It feels like it's coming from inside the bone, not just the surface. It doesn't go away with rest. Unlike muscle pain, which improves with relaxation, this pain persists, even when you're not moving. It gets worse at night. Many patients report that bone cancer pain worsens at night and wakes them up from sleep. If you have ongoing pain in your bones that isn't improving or is getting worse over time, it's time to take action. Unexplained fatigue and weakness. Feeling tired all the time? Not just a little tired, but completely drained even after sleeping? Bone cancer robs the body of energy. Cancer cells steal nutrients, leaving you feeling constantly fatigued. Muscle weakness sets in. You may struggle with tasks that used to be easy. Even light activities feel exhausting. Cooking, walking, or even standing for long periods might feel impossible. If your energy levels have dropped dramatically, and no amount of rest helps, it could be a sign of cancer-related fatigue. Rapid and unexplained weight loss. You haven't changed your diet or exercise, yet the weight keeps falling off. Sound familiar? Cancer alters metabolism. It forces the body to burn more energy, even at rest. You lose weight, even if you're eating normally. Clothes start feeling looser and your face may appear thinner. Appetite may decline. Many patients lose interest in food due to chronic pain or nausea. If you're losing weight without trying, it's time to investigate why. Night sweats and unexplained fevers. Are you waking up soaking wet from sweat, even in a cool room? Are you experiencing random fevers for no reason? Bone cancer can cause temperature spikes. The body reacts to the tumor by triggering fevers and night sweats. Disrupts sleep and drains energy. Waking up drenched leaves you exhausted the next day. Can be accompanied by chills. Some people experience alternating hot and cold flashes. If you frequently wake up sweating, or get fevers that don't seem connected to a virus, don't ignore it. How to reduce your risk of bone cancer. Now that you know the signs, here's what you can do to protect yourself. Know your family history. Some bone cancers run in families. Limit radiation exposure. Only get X-rays or CT scans when necessary. Monitor pre-existing conditions. If you have arthritis, osteoporosis, or chronic joint pain, get regular checkups. Eat a bone-strengthening diet. Focus on calcium-rich foods, leafy greens, and lean proteins. Exercise regularly. Weight-bearing activities strengthen your bones and lower your risk of cancer. Final thoughts. Don't ignore the warning signs. If you notice any of these symptoms, don't wait. Get checked ASAP. Early detection saves lives. Did this video help you? Smash that like button and share it to spread awareness. Subscribe for more life-saving health tips. Stay safe and take care of your bones.